when I was 44, I was exercising with my friends and noticed when I would lay down on my stomach on some of the machines that I could feel something inside on my left side. Also, if I were to lay on my right side, I could feel a heaviness or a pulling on my side. And, I'd ask my husband, do you feel this? Do you feel this? Is there something there? And so it took me a while to get into my gynecologist. And when I did, he did an ultrasound. He said, your ovary is quite large. We need to get it checked out. This is not my area of expertise. He said that you could go down to Albuquerque, to my oncologist down there, or he said his partner had moved to Durango, which was only 45 minutes from our home. So I decided to go there because it was much closer. He did another ultrasound, examinations and tests and things like that. My CA1 levels, which is a tumor marker for ovarian cancer, was elevated. So they prepared to do surgery and did the surgery. And when he came out, he told me he had been a gynecologic oncologist for 35 plus years. And he said that he could count on one hand how many times he's found ovarian cancer in a stage 1, and even fewer times contained in the ovary. And so that was a good thing. That was a positive thing. It was devastating to be told you had cancer for the second time. That was really hard. And I knew enough about ovarian cancer to know that it was quite scary. So he recommended 3 to 4 rounds or 3 to 6 rounds of chemo, and my husband and I felt 3 rounds was good because it was contained in the ovary, and after a lot of praying, we felt that 3 was good. After I got to 3, we were like, okay, we're done, that's good. And that was great. That seemed to take care of things. They call ovarian cancer the silent killer because a lot of women who are older, entering menopause age, a lot of these are hormone driven. A lot of these female cancers are hormone driven. A lot of the symptoms like bloating, loss of appetite, back pain, stomach tenderness, things like that, mimic menopause. And so, you can go to a doctor, you can go somewhere, you think you're having hot flashes, those types of things. And in reality, if you don't go to your gynecologist, you might not know. There's heavy bleeding, there's things like that, abnormal periods. Those can be indicators of ovarian cancer. So it's just good to get it checked out. I have done some fundraising through Ovarian Cancer Australia. I have a friend, Carrie Vincent. Most people know her as the judge on Food Network. She does judge the cake challenges, things like that, wears the headband. She's a wonderful woman. Her mother passed away of ovarian cancer, and she is a very big advocate for ovarian cancer, and she and I have had lots of talks about that. And she's very big. She's from Australia, and so she has raised a lot of awareness for ovarian cancer in Australia and here in the States. And I think that is one of my causes as well, is to help as much as I can with cancer research and cancer awareness. I think that's very important. And so with ovarian cancer, there's a lot of variables, but it is a silent killer because most of the time it is not found until it is a stage 4. And we had a neighbor who passed away when she had young daughters of ovarian cancer, and it was stage 4. If you have ovaries, you can have ovarian cancer. There are children as young as 8 who can have ovarian cancer. It's something as a woman that we have to deal with. And of course, there are a lot of, childhood cancers and things like that you need to be aware of. But ovarian cancer does strike at any age. Teenagers, older women, you can have ovarian cancer when you're in your 80s. You can have it, when you're very young. So it's a risk just by having ovaries. Uterine cancer is a little different. It's in the lining of your uterus. Again, there are some of the signs and symptoms would be, heavy periods, feelings of bloating, and things like that. I don't know very much about uterine cancer. They just told me I had it, and I was like, all right, we yanked it all. So